Hey everyone, it's Dr. Brace here for Facial Plastics Friday. I'm with friend and colleague, Dr. Cameron Chestnut, and you're in Spokane, Washington, right?
Yep, Spokane, Washington.
And I'm a big fan of Cameron's work and his account. He has a really different approach to regenerative and rejuvenative surgery and medicine. And so thanks for doing this, Cameron.
Yeah, absolutely. Thanks for having me.
Yeah, it's my pleasure. I wanted to ask you, I did this last week with another colleague, but I wanted to ask you, what's your prediction of what the next big thing in regenerative medicine, what's on the horizon that you think is going to kind of explode and be the thing that we're going to be talking about more, researching more, incorporating more into practice?
Yeah, I think that I could break this down even to like surgically, during surgery, and after surgery too. And I think that leading into surgery, it's going to be things like peptides and hyperbaric oxygen, things that are really great post tools that don't get used enough before now.
Right.
So I think that that's on the horizon. Intraoperatively, that's where it's, that's where we play. It's where we get creative and have fun, right? So there's most of it there. And there's a lot of things that are at our fingertips already that we're all using that are highly regenerative, and we're just discovering their potential a little bit. Different types, we were talking before about even reconstructive surgeries, like different types of blood-based growth factors with PRP and PRF and fibrin matrices, and then of course fat, nanofat, all types of regenerative capacity and options within that. And then we get into the post-operative phase, and that's where in my practice, this is things like IV stem cells, IV exosomes, using exosomes post-operatively, topically for laser cases, things like that. Where, for me, those are exogenous, or we call them allogenic, right? Coming from somebody else from a regenerative capacity. And in the operating room, we have all the ability to do it autologously with their own regenerative factors. It's really cool.
It is. It's exciting. I admit I'm a slow uptake on this sort of thing. Didn't train with it. It was all a little bit foreign to me, but I've recently incorporated a lot more fat grafting into my practice and starting to do the nanofat. And I'm really excited about nanofat and the potential there being autologous, being harvested at the time of surgery.
Right.
And specifically in my community, we have winter for way too long.
Mm-hmm.
And so a lot of older Canadians, when they're retired, go to Florida. And they spend November till April there, and they get weathered. And so I'm doing these facelifts on a lot of mostly women that have these really thin, weathered necks. And CO2 laser, I'm a little uncomfortable going down there with the laser aggressively, but I think nanofat in that area especially is going to really improve the results we're able to get with face and neck lift surgery when we're talking about that kind of weathered aged skin.
Absolutely. We know that direct injection of that nanofat into the skin upregulates the precursors for elastin.
Right.
And collagen's cool and hot, and everybody talks about it, but elastin is the one we really want to be rolling along. So it's great.
Absolutely. So you did touch on exosomes, which we incorporated about 6 months ago into the practice. I do a lot of CO2 laser resurfacing. Mm-hmm. Are you putting that on immediately after, or how are you doing that?
Yeah, immediately post for my patients, I'm using their own growth factors as PRP or PRF afterwards, and because I have it, it's there, right? It's easy to access. I'm using exosomes more in the post-operative period where I don't want to necessarily get vascular access back on them again.
Okay. So just a topical application, are you microneedling, or what are you doing?
Topical, usually not microneedling because they're post-laser, but topical, or again, if we're doing post-operative IV nutrition or post-operative stem cells, we'll follow that up with sometimes using IV exosomes as well.
Cool. Awesome. Well, I encourage everybody to follow Cameron. You'll learn a ton, and it was great catching up with you.
Absolutely.
Thanks a lot.
Thank you very much.
Great.
Absolutely. Yep.